Restez prudents. Nous vivons tous des moments anxiogènes. Have I lost my marbles? Is it because my hair is all unruly and dishevelled this morning and I haven't really shaved? Why am I speaking in French? Well, it's because what I just said, restez prudent, is the French equivalent of our new motto of staying alert rather than staying home. Welcome to Arm Wrestling with COVID-19 in London. This is number 18. Mind you, before I go into the core of what I wanted to share with you today, let me also make it very clear that I fully understand that the Prime Minister and his colleagues are facing a huge challenge. It isn't easy, and I don't belittle those challenges. But listen also, Boris Johnson is the Prime Minister, not I and you. And much as I'm quite happy that there is less of the buccaneering attitude in the PM's delivery, and also less of the squashing of sombreros, what we really need today, at this moment of uncertainty, is leadership. Leadership that is clear, that is direct, and that is less nuanced or ambiguous. So, as Sir Keir Starmer, the relatively new leader of the Labour Party, argued in the House of Commons only yesterday, is there clarity with those small tweaks included in the 51-page document that are meant to reassure the public at large that all is going in the right direction? It seems to me that the Prime Minister has invited us to be a little less careful, but still extremely careful. And the government seems to be assuming that many people will have to go to work, rather than it presuming that they don't need to do that yet. So let me focus just a little bit on the inconsistencies in those changes that are affecting us in England, but not those living in Scotland, Wales, and Northern Ireland. Let me start with the first one. Hand in hand with this small, gentle nudge to go to work, the government added that the labour force should also avoid public transport. But how? And will this not inevitably put some of the lowest paid earners at the mercy of their bosses? You say cars. Many of those who are not high earners or even middle earners cannot afford to go by car to work. What about bicycles? Yes, we see lots of bicycles on the roads these days, but a lot of people do not have bicycles. And in fact, what struck me quite a bit was a little item in one of the news programs a couple of days ago, which said that President Macron of France had decreed, that's how he works, had decreed that every person in France, every Frenchman or Frenchwoman who wants to use a bicycle or has a bicycle in the shed in the garage, but that bicycle needs repairing, needs spare parts, etc., the government will contribute 50 euros for the repair of that bicycle. So if cars are not readily available, and if everybody doesn't have bicycles, where do we end up with? We end up with buses, underground trains, and the normal trains. What does that mean? That means that social distancing will be very, very difficult to implement. This business of stand side by side, don't stand facing each other, doesn't cut mustard with me, because public transport will be overpopulated, whether we like it or not. And so how do we manage physical distancing, forget social, physical distancing under such circumstances, then let me flag another point. Schools. Can schools really secure that social or physical distancing that we require? Have you seen some of those schools? Have you seen some of the photos on the telly about those schools in those narrow corridors? How are you going to make sure that there is social distancing with kids who are happy being rowdy, who are happy running around, and who aren't necessarily going to calculate 2 meters or 6 feet to stay away from each other? And if people do go to work, let us assume that they found a way to go to work, they walked, they took the bus, they even cycled there, or some of them took the car. What about childcare? Not everybody is going to school. So what happens to those who are still staying at home? What about the quarantine system? I understand, for instance, that the scientific advice now says that we can quarantine people coming into the country for 14 days. Now, the first question I'd ask is, why didn't this happen 2 weeks ago? But the second question I would ask in the inconsistencies that I find in our policies, and those are inconsistencies that are almost sometimes teething problems, but they're important teething problems. If somebody is coming from France, apparently you can come into the UK without having to worry about the quarantine. That's great. L'entente cordiale, vive l'entente cordiale. We need each other, we need the tourism. But what about an Italian, a Tunisian, a Kuwaiti, why not a Bulgarian, whatever, going from their country to France and then from Paris coming to the UK? Will they have to quarantine, or will they also walk into the country? What is the idea and what is the methodology behind this decision? These are some of the questions, and there are many, many more. All you need to do is go to the telly, listen to the radio, read the newspapers online or paper, and you will see a whole host of inconsistencies that lend toward more confusion and that detract the clarity that I'm sure the PM would wish us to have these days. So, to have a chance for easing the lockdown, what we also need, in addition to those inconsistencies that need to be addressed, are testing and data. They're very, very important. Do we have the human resources, and do we have the money to do that? Those new measures were meant to kick in yesterday, Monday. Now they're supposed to kick in tomorrow, Wednesday. Do you honestly believe that in 2 days, we suddenly will have the vital human resources and the money to do so? I doubt it. So who will suffer at this stage? Of course, the frontline NHS staff, the care workers, many others who are rendering a huge public service to us all, but ultimately us also, the great unwashed. Hence, my concern today. At the end of the day, what I'm trying to say with this YouTube is not to make an educated, learned address or study or scrutiny of those 51 pages. Many, many people have done that, and they're more qualified than I. I'm just giving you an instinctive reaction. Somebody living in London, somebody trying to abide by the rules, who suddenly sees confusion, who sees lack of clarity, who sees different ministers singing from different hymn sheets, and wondering, where are we actually going? No wonder the unruly, dishevelled hair. But to sugarcoat words is not enough. To basically try and come on a radio program and insist that they've got it all under control and it's all going to be fine is not enough. What we need with that clarity is the honesty and the transparency that I've been rabbiting on for ages. Because at the end of the day, whether we like it or not, this is a very difficult choice that the government is making, and perhaps we also eventually will make in our choices between health and lives on the one hand, and economy and livelihoods on the other. The danger here, and that's what worries me, the danger is that any slight miscalculation puts us in peril and restarts this danger from the beginning. And so for that to succeed, for us to succeed in our future phases as we come out of lockdown and as we try to beat this nasty adversary, is clarity, not confusion and prevarication. That is the message. A friend of mine always tells me, when you do your YouTubes, you should have a central message. Well, my central message is this: give us clarity. Don't chew on your words. Don't sow confusion, and don't prevaricate when you talk to us, whether on the Today program or on the telly, or even when you address the public or give us your briefings. The British people, we are mature enough to deal with clarity, but we cannot, in my opinion, understand a lack of clarity. So let me leave it today with this simple thought, this simple central message: CLARITY, clarity. And let me also say that this particular YouTube number 18 is dedicated to International Nurses Day that falls today on the 12th of May. Those nurses are the real heroes and heroines of this saga. But remember, those nurses have been heroes and heroines way before we discovered something called COVID-19 and spikes and whatever. And I'm sure they will stay so once we are over this pandemic as well. The NHS and those nurses are very dear to me, not only in the abstract. They kept me alive a few years ago. And from the stories I heard and from the program I watched on BBC Two yesterday about what they do, them and the medics in hospitals, to try and save people from certain death, is remarkable. So thank you, nurses, on International Nurses Day. You, as much as us, need everything from PPE and kits and equipment and what have you, but you, like us, also need clarity.